Hello and welcome to your PowerPoint presentation on physical assessment, that is Teaching Learning Objectives 3.1b. Today we're going to be talking about the purpose of a physical assessment, how diversity and cultural background influences how healthcare providers provide care, some techniques that we use in completing a physical assessment, how we prepare our patient both physically and psychologically, and the findings that we would find in a young adult, middle age, and older adult, and the approaches we would take in assessing them as well. So, what is the purpose of a physical exam? Well, there are many reasons why a nurse has to complete a physical assessment. If that patient is in acute care, long-term care, or even home care, doctor's offices, we are required to perform a physical assessment or a screening. If a patient comes to the emergency department, an assessment has to be completed because we need to find out what is going on with the patient. Why is this patient presenting with headache or chest pain, whatever the case might be? If they're in a doctor's office, we want to do some assessments to assess for any preventative health measures that need to be taken. Often, if you are applying for a job, we have to do an assessment to ensure that they're qualified health-wise, or for you, even coming into the nursing department, you had to go and do some assessments and get some things done in order to be qualified to participate in nursing. So there is various reasons why nurses do assessments or healthcare providers do assessment on our patient. So depending on where, depending on where this patient or the patient presents, so if it's in acute care or if it's in the ER, I'll just say use ER for an example, and the patient is complaining of chest pain, the nurse will do a focused physical assessment. If the patient is on the third floor, cardiac floor, or if the patient is on the medical surgical floor, a physical assessment to those specific areas are performed. For example, if a patient presents with asthma, so the focus will be on listening to the lungs, a pulmonary assessment to rule out whatever the patient is complaining about so that the treatment can begin. So the whole idea is to gather data so that a nursing diagnosis can be formed, a medical diagnosis can be performed in order for the patient to begin treatment. So the nurse gathers that baseline data. Always important, and as you guys go into the clinical area of nursing, you guys will be on OB, you guys will be on rehab. It will be extremely important to get that baseline data as soon as you can in meeting your patient so that you'll have any information that's needed to continue on with the care that your patient needs for that day. You will also have information from the patient's chart, as well as a report from the nurse previous. So your physical examination validates the findings that was presented in the patient's health history or reported to you by the off-going nurses. So as you continue to move into the clinical setting, you will meet a diverse group of people, young, old, different cultural backgrounds, people who have different health beliefs and practices. And so as a nurse, you have to be aware and you have to also be culturally sensitive as you perform a physical assessment. It's important to remember that cultural differences influences patients' behaviors. All patients may not be receptive to Western medication or the way we do things. And so that's why it's important to do an assessment so that we can note if there's any alternative therapies or nutritional habits that we need to be aware of. And even just getting super close to a patient. All patients are really not comfortable with physical closeness during an examination. So, I mean, it's kind of hard not to be close when you're doing a physical exam, but these are some of the things that we have to be aware of so that our approach would be considered. So we would think, how will we approach this patient if there's a cultural awareness of not being, a cultural sensitivity of not being, directly up on that patient, or how we approach that patient. Some of those things have to be considered. So we have to always be aware that everyone is not like us and everyone is very different. We want to be aware and avoid any stereotyping based on a patient's gender, their race, their educational level, or any other cultural background factors. There is differences between cultural and physical characteristics among various ethnic people in the community. We have to note that we do have some knowledge deficits related to differences, cultural differences in racial ethnic backgrounds. So all people of a darker tone may not be from the same cultural background. We can't lump all people as being white because of the color of their skin. And we certainly can't lump all people as being African American because of the melanin in their skin. Each culture is very different. And so just being aware of that is super important. You all will get an opportunity to do a health assessment. And one of the questions on the health assessment is, what is your ethnic or your cultural background? If I'm not mistaken, I believe that is one of the questions. And what I've noticed in the past is students will write in white or black. White and black is a color, but it's not an ethnic cultural background. So for instance, people may be Hispanic, they may be Irish, they may be German, they may be Creole, they may be African. So there's a lot of descents that we need to be aware of, and certainly be culturally sensitive to those differences and acknowledge the lack of understanding, but yet always ask to find out. Then when you have some data, you can do some background research to figure out how will I approach this cultural patient from a different descent. By addressing cultural diversity, you demonstrate that you respect each patient's individual uniqueness. And so by respecting that individual uniqueness, this in turn leads to higher quality of care, and it improves the outcomes of all people. So this slide talks about preparing the patient during a examination or during our routine physical examination. And most often, the first thing we want to do is prepare the environment. And in preparing the environment, we want to make sure that we are respectful. We want to make sure that the patient has privacy. We want to make sure that if the patient is in an office, or if they are sharing space with another patient, that we're not loud and we're not exposing the patient so that the patient feels comfortable in that assessment. So we want to make sure that the room is warm. We want to make sure that the patient has everything that they need to feel comfortable in that environment. We want to make sure that the lighting is adequate so that we can see the body parts that we're assessing. We want to make sure that there's not any noise. If the TV is on, we want to make sure that the TV is off or the volume is down. If the patient is laying flat and the assessment needs to be in a position where the patient needs to sit up, we want to make sure that we assist that patient in sitting up. And that comes with just observing our patient and see if they're older or if they are having any discomfort anywhere. Just extending that helping hand and assisting them into the position that needs to be examined is important. Some patients may require a small pillow behind their head and neck for comfort, or legs or knees. Whatever that may be, we want to make sure that we provide an environment that is comfortable, because an assessment, for one, is uncomfortable, and patients, they don't really know you, and so to make them comfortable and feel as comfortable as possible will make the assessment go smoothly. You also have to make sure that you're comfortable in performing the assessment. So, for example, if the patient is in the bed laying flat and you are, let's say, pretty tall, because all beds should be at the lowest level when you get there. It's okay to raise the bed up to a comfortable working height so that you're not bending over and you get tired or you get wore out and don't complete the assessment to its fullest potential. So you may want to raise the height of the bed to reach the patient comfortably. With the physical preparation of the patient, again, when we make sure that our patient is physically comfortable, their needs are being met, then that demonstrates a high respect level for our patient. We ask our patient, before we even get started, do you have to go to the bathroom? Because a lot of the assessments that we do, if we're doing an overall assessment, not so much focused on an incision of some sort, it may require that we push on their bladder. And so asking our patient if they have to empty their bladder or if they have to go to the bathroom for whatever reason is really, really important. Sometimes we have to collect specimens, and so if so, then we would instruct our patient what to do, and we give them cups or anything that we need to collect any urine or feces. So we physically prepare our patient, making sure that we maintain their privacy. We also be aware of those cultural differences and cultural aspects. We always washing our hands because we want to show our patient that we believe in infection control. So going into the room, washing in is really important, and them seeing us washing hands is really, really important. Some patients look back and say, they came in here and they didn't wash their hands. Patients watch that, and then survey comes out, and one thing they may say is, well, when my healthcare provider came in, they didn't wash their hands. And you may have outside the room, but sometimes it's just good for the patient to see that you are practicing proper hand hygiene and safety. You want to make sure that you're organized, and that comes with practicing. When you guys get into the clinical setting, you will have a list of things that you will do. So you have in rehab, most often there's a focus assessment because you have patients in there who have had strokes. They may have had a neurological neurological issues. They may have had multi-vehicle accidents that have broken legs and things like that, that you would focus on. That is like a direct focus that you would be assessing, but you'll also get an opportunity to do an overall assessment where you will listen to the lung sounds, the bowel sounds. For the most part, you always listen to a patient's lung sounds, heart sounds, and bowel sounds through any assessment, but then you'll have that focus assessment as well. On rehab, it may be looking at the leg that's been amputated or assessing the side of the body that's had a stroke. In OB, same thing as far as the overall assessment. So you have your lung sounds, you also have your bowel sounds, heart, pulses, but you'll also assess the perineum. You'll also assess the patient's fundus to see if it has descended back to normal size. So there's some focus assessments in your overall assessment that you guys will have to do, and you want to make sure that it's smooth, it's organized, and that there's no interruption. So you want to make sure that you are aware that disorganization could cause errors as well as incomplete findings. So you want to make sure that you're organized prior to going into the room. And we, as your professors, will make sure that you are clear as to what you do and how you do it before you go into the patient's rooms. If you're working in a doctor's office, which is most often that happens, it just depends on where you're working. Most often the patient will be asked to undress. And depending on what type of office it is and what the assessment is, they'll be given a gown. So providing privacy is extremely important in people getting undressed. I wouldn't be in the room while that person is getting undressed. Give them the time to undress. Most often they're given paper gowns. You may even work in, I would use the example of you work in a clinic where they're doing mammograms. And so mammograms, often they have to take off their top and they're given a gown or a paper gown. And so giving them that privacy, making sure that they're warm, there's no drafts, and privacy is extremely important because the patient is anxious and there's a lot of anxiety. So our goal is to decrease the anxiety by explaining everything that we're going to do and providing comfort to them during the process. There's various positions that healthcare providers will ask our patient to assume. Depending on what exam is being done, we want to make sure that we assist our patient into those positions. Again, patients may not have the ability or the strength or mobility to move around. So that is where we offer our assistance in helping them to assume those positions. We always want to respect and show consideration and lump things that can be done together in maybe that one position so that we don't have our patients sitting up, laying down, turning to the side. Maybe we can, if you think about it, you critically think, what can I do with this patient in this position, especially if it's an elderly patient who can't really move as quickly or is as mobile as others. So we want to make sure that we use that extra care when positioning our older adults and those who have disabilities as well as any limitations. And I'll show you some positions to examine patients on our next slide in just a moment. But I do want to address the psychological prep when assessing patients. We have to remember again that the examination is stressful, it's tiring, and these patients experience anxiety. So when we explain to our patient what we're getting ready to do and what they should expect and how we need them to cooperate, that is everything to them because then they know what's coming. We also want to make sure that our patient understands, and we ask them that if they have any questions about what we're doing, please do not hesitate to speak up. You as the healthcare provider, not talking as much, kind of listening and allowing the patient to ask questions and communicate That's a good thing when you're doing assessment. You don't want to be too casual because that will doubt the competence of the healthcare provider. The patient may believe that you're not competent when you come in with a casual style of assessment. So think about that when you're assessing your patient. You want to be quiet so that they can ask the questions, after you've given your instructions and things like that, but you don't want to come off as being too casual. And again, remember our cultural or social norms. So sometimes if it's a female patient that a male is taking care of, the family or the person may not be comfortable within that situation. So most often you can have someone else in the room, a culturally approved family member needs to be in the room or someone on the health staff may be able to come in and be there to help support, and vice versa. And we will see that in OB, where anytime an assessment is being performed by our male students, the nurse will be in there or your professor will be there by your side to assist you. We always want to watch our patient response to our assessment. We're observing emotional behavior, we're looking at facial expressions, especially when we're palpating or pushing on any body part that can possibly cause any pain. We want to note if this patient is showing some anxiety in the process, squinting. Those things tell us a lot, and so that's part of our assessment and our documentation process. For us, we don't want to create an atmosphere of anxiety or stress, so we have to remain calm, cool, collected throughout the process, and then the patient will be relaxed throughout the process. If you're anxious and you're nervous and you're dropping stuff and you're moving real fast and all over the patient becomes very uncomfortable. You also want to note during the assessment if your patient is tolerating that assessment. We don't want to force our patient to cooperate. We ask them, we tell them how long it's going to take, and we stay within that time frame. But that comes with us being calm, relaxed, and thorough, and moving easily through our assessments, as well as organized as we move through our assessments. So going back to the positions to examine patients, here are a variety of positions that your patient may be in. This can be found in your Potter and Perry table 30.2. And as you can see, you'll have to know these positions: sitting, supine, dorsal, recumbent, lithotomy, SIMS, prone, lateral recumbent, and knee chest. So these are various ways that patients can be in depending on what the examination entails. As you move throughout your nursing career, you're going to get an opportunity, depending on where you work, I should say, to assess various age groups. And there's different interviewing styles and approaches and examination depending on the age group of the patient. With children, we have to be aware that they're scared. Infants and children, they're scared. They don't know. It's unfamiliar. They're just afraid. They don't know. So we have to be sensitive and anticipate that child's perception. This assessment for the child may be routine screening that focuses on their growth and development. It may be a behavior assessment. It may be dental. So just that overall assessment, unless that child has been diagnosed with something that's a little bit more serious, then there will be focus assessments. However, most often the parents are there. So we gather the patient's history or the child or the infant's history from their parents. And so we do things like open-ended questions, and you guys will get an opportunity to do a health history. So you'll learn all about open-ended questions and how you perform those interviews to get that history about symptoms. The whole idea is to gain the child's trust. So talking to them about different things prior to you starting your exam, letting them hold the stethoscope and listen to your heart, or in the beginning, so that they can become familiar and not feel threatened in that area. When you're performing the exam on the infants and children, especially children, infants, sometimes they, depending on the age, they may just be really afraid of what you're doing, but can be distracted in a sense by the parent. However, with children, you want to make sure that, of course, we're doing our visual examination, and then we move, from the peripheral to the center, and we start with the extremities, and then we move towards the chest when we're listening. So we kind of want to start like further away and then kind of get a little bit closer. A lot of times they accept that. We want to make sure that we're not passing any judgment, or the parents don't feel like there's any judgment being passed. We want to call the children by their first name and always address their parents with respect, as like Mr. or Mrs. or Miss, rather than using first names unless they tell you to. We treat adolescents as adults and individuals because they tend to respond when they're treated more as an adult. We speak to the parent, but we also speak to the adolescents, and sometimes we may have to speak to the adolescents without the adult. When assessing an older adult, it's important to assess the patient's ability to perform activities of daily living, like bathing, eating, grooming, making phone calls. Those type of things sometimes come with the assessment of the older adult. We also have to recognize that older adults have some deficits and some physical limitations that we need to be aware of. We make sure that we don't stereotype about older adult and their level of consciousness. Not all older adults have some cognitive impairment, or may not have at all. It just depends on, but we need to be aware that the older a person gets, there is a potential for that patient to lose some cognitive function. And so we need to recognize those things there and be able to adapt to them during the assessment. But patience is key when assessing an older adult, as well as space, because some older adults, they have mobility aids, canes, walkers, so we want to make sure we have enough space. We also want to be aware that during assessment of an older adult, depending on the circumstances, this can be really stressful for these patients because they are afraid. They do not want to lose their independence. Some of them are afraid that they, if they tell too much, of problems that they're having, that they may be sent to a nursing home. And so they may opt out telling you certain things, but just reassuring them that you're here to make sure that they receive the best and highest quality of care, and that the goal is never to institutionalize them as they become older. Be aware that sometimes during an assessment, the patient may have to go to the bathroom right in the middle of the assessment, and that's okay. Stop it, let them go. Always offer prior to, especially if you're doing an assessment, it may take longer than you want it to take, and so they may have to go. We want to make sure that we are aware, again, of facial expressions, of them becoming tired, irritable. We can stop the assessment, but if you are organized, you can get through the assessment. But if you don't get through it, you can certainly come back, in the older adult and get what you need. So here's the slide that talks about general survey, the appearance and the behavior of the patient. So when a person or patient enters into the examination room or into your presence period, first thing you want to observe is how that person walked, their general appearance. You want to be aware of their behavior, how they're dressing, all those things you want to be aware of, because these are things that you're going to be documenting on, right? What do they look? You may not know their age, but you can kind of guess their age. If they're in distress, body type, posture, body movements. Are they clean, odor, dressed? Are they irritable? Are they smiling? Do they speak? Is it clear? Is it a different language? Is there any signs of abuse? Most often, we as nurses encounter people who have been abused or trafficking. Those are something that we have to be aware of when we do a general survey. Do they have someone else in there with them that's speaking for them if it's a young person? And are they speaking for that person and that person is not really allowed to speak, or that person don't want to move out of the room during an assessment? All those things could be signs of abuse or trafficking that we have to be aware of. Signs of malnutrition. Just in the news, it was something where kids were being abused by their step parents, and they were very thin, extremely thin, because they were malnourished. They were not given food, and so they were malnourished. Those are things that you notice and you observe so that you can report. In that general survey, if you note, for instance, there's a female patient who has bruises on her back, arms, legs. Her behavior is very introverted, and you determine that this could be an issue because maybe the person that brought her in has been abusing her, or you don't know that for a fact, but there's a potential. It is imperative that you and the proper authorities get help to find this patient safe housing or seek protection from the abuser, because the risk for abuse is even higher, especially if the victim reports it or tries to leave the abusive situation. So these general surveys are extremely important because most often we are the first person who know that there's something wrong. All right, exam organization. We want to follow a systematic routine when you're performing a physical examination because we don't want to miss anything, right? Head to toe approach usually includes all body parts. So we want to compare both sides. You guys will get an opportunity to come into the practice lab. I always say if you split the body in half, you always have one eye on the left, on the right, the nose, nostrils, mouth, teeth. Again, we can start even higher than that with the head. So that's the head. You're looking in the head, looking at the hair and the scalp, everything that's on the body. That is a full head to toe assessment. And by the end of 126, your final test out will consist of a head to toe approach. If the patient is really sick, we want to first assess the part that's at most risk. For example, if the person is having some chest pain, you assess the cardiovascular assessment if that patient comes in complaining of chest pain. We always perform painful procedures at the end of the exam because we don't want to cause any pain until we don't want to cause pain at all, but if we have to cause any pain, it's at the very end. When we complete our examination, we definitely have to document our findings. That is the policy of all facilities, and most facilities are paid based on the findings of that patient assessment. So when we're documenting, you guys will learn the common and acceptable medical terms and abbreviations in order to chart. It depends on where you work, whether it's computerized charting or whether it's handwritten charting, you should know both. When doing your assessment, you may want to have a little pad to write information, not computer pad, just like something to write, to, quick notes to make sure that you have everything that you need before you go in and do your documentation. Okay, and this is our final slide, but yet there's a lot of information that you need to know here. Physical assessment techniques. First thing, inspection. What is inspection? Looking, listening, and smelling. So when we inspect something, we are determining whether it's normal or abnormal. And you guys will learn the difference as you move through. You have to be able to hear, smell, listen in order to inspect properly. And it occurs when you are interacting with the patient. You're watching for any nonverbal expressions, any emotional or mental assessment, physical movements, anything that seems to be abnormal. So you're looking at it and you're going to have to document it because it's what you see. So it's important to pay attention to detail. Therefore, you must have adequate lighting. Either direct light with a pen light, you may be looking in a patient's eyes, so that'd be a direct light, or indirect light, the light is just overhead. You want to inspect each area for size, shape, color, symmetry, position, abnormality, and you only want to expose the part that you're inspecting. So if you're, let's say for instance, you're inspecting a patient's breast in OB, you will have to do that. You only want to expose one side of the breast at a time because you want to make sure that, again, you keep your patient comfortable, warm, and respectful. We always compare one side to the other. So we're going from side to side symmetry. We also want to know if there's anything, any body odors. Super important. Olfaction helps to detect abnormalities. For example, if a patient has diabetes and they are experiencing some ketoacidosis, right? We can smell that. That smells sweet, fruity. And so we want to make sure that we're assessing when we're inspecting that we note any odors. If a patient has an infection, most often you can smell when a patient has infection. Now the book has these in different orders, in a different order than I have them. I put them in this order because I feel as though after you inspect, you should listen before you palpate. In the book, it'll tell you palpation may be used concurrently with inspection, and it just depends on what you're inspecting. So if you're inspecting the abdomen, of course, you don't want to palpate before you auscultate. Auscultate means that you listen because you will create more bubbles in the stomach, and that will skew your abdomen assessment. And so it just depends on what you're inspecting and what you can concurrently palpate at the same time. So when I talk about auscultation, again, that is just listening to sounds that the body makes. And we have our stethoscope that we use in order to listen to those internal body sounds. So those internal body sounds, you'll hear blood. You can hear blood, you can hear air, you can hear gastric content, you can hear the heart sounds. When you listen to the heart, you are hearing the valves close and you hear the blood that moves through the cardiovascular system with your stethoscope. You will learn the normal sounds of the heart, the bowels, the lungs. You're going to learn all those different sounds, and you're going to learn the abnormal sounds as well. You have to be able to hear well when you have your stethoscopes. There are stethoscopes out there that have extra sound amplification. If you know that you have a hearing deficit, you have to purchase the one that has amplification. Palpation involves the sense of touch to get more information. So it is through touch that you make these judgments or these findings that are expected or unexpected. You may palpate the skin to note the temperature or the moisture or the texture or any tenderness, thickness in the abdomen area. If you note if there's any distension or any masses, these are all the things that you can find using the palmar surface of your hand or the finger pads, which are more sensitive than fingertips, to assess or determine anything that's normal or abnormal. And last is percussion. And percussion involves tapping the skin with the fingertips to vibrate underlying tissue and organs, often done by a doctor or an advanced practice nurse. It's that vibration that travels through body tissue, resulting in sound. And so the denser the tissue is that's being percussed, the sound may be quieter. Again, this is done most often by an advanced practice nurse or a doctor. So for the most part, you will learn all these different techniques as you enter into the clinical setting, as you enter into our practice labs. We will help you and assist you in inspection, auscultation, and palpation, as well as percussion. We'll show you how to do that. And so this is the end of the presentation. Thank you.